Autism spectrum disorder affects about 1 in every 88 children currently living in the United States. Since the disorder is a wide spectrum of difficulties rather than a singular condition, it is difficult to provide a general definition. However, few generalizations have been found, such as autistic individuals are known to have reduced awareness to new experiences and little to no capability to act or think creatively. Lower functioning individuals may fail in developing functional speech and most often suffer from accompanied learning disabilities. On the other end of the spectrum, higher functioning autistic patients can usually develop adequate linguistics and intellectual faculties. Autism is often accompanied by a lack of understanding underlying intentions within people's actions. While there is no cure for autism spectrum disorder, psychologists have found that music therapy can be extremely effective. In fact, autism is arguably the clientele in which music therapy has the highest reputation. Children are able to better communicate through music when compared to other communication forms. Music therapy helps improve understanding of verbal command by connecting auditory and motor sections of the brain. Emotional expressions and social engagement were also proven to increase during music therapy sessions, according to a 2009 study. Peer interactions is encouraged through passing instruments, music and movement games, and learning to listen and sing. Children with autism have high anxiety due to the inability to filter out provoking stimuli. Music therapy has been proven to reduce this anxiety and the behaviors that accompany it.
Alzheimer's is a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. Alzheimer's is the most common form of dementia, a general type of memory loss and other intellectual abilities serious enough to interfere with daily life. Alzheimer's disease accounts for 60 to 80% of dementia cases. Alzheimer's is not a normal part of aging, although the greatest known risk factor is increasing age, and the majority of people with Alzheimer's are 65 or older. But Alzheimer's is not a disease of old age. Up to 5% of people with this disease have early onset Alzheimer's, also known as younger onset, which often appears in someone in their 40s or 50s. Alzheimer's worsens over time. Alzheimer's is a progressive disease where dementia symptoms gradually worsen over a number of years. In its early stages, memory loss is mild, but with late-stage Alzheimer's, individuals lose the ability to carry on a conversation and respond to their environment. Alzheimer's is the 6th leading cause of death in the United States. Those with Alzheimer's live an average of 8 years after their symptoms become noticeable to others, but survival can range from 4 to 20 years, depending on age and other health conditions. Alzheimer's has no current cure, but treatments for symptoms are available and research continues. Although current Alzheimer's treatment cannot stop Alzheimer's from progressing, they can temporarily slow the worsening of dementia symptoms and improve quality of life for those with Alzheimer's and their caregivers. Today, there is worldwide effort to find better ways to treat this disease, delay its onset, and prevent it from developing. Music therapy. The evidence-based use of music interventions to accomplish individualized goals with a therapeutic relationship by a professional who has completed an approved music therapy program. With Alzheimer's, music can be powerful. Studies have shown music may reduce agitation and improve behavioral issues that are common in the middle stages of the disease. Even in the late stages of Alzheimer's, people may be able to tap to the beat, sing lyrics from a childhood song. Music provides a way to connect, even after verbal communication has become difficult. When using music therapy, identify music that's familiar and enjoyable to the person. If possible, let the person choose the music. Tap to the beat, sing lyrics from a childhood song. Music provides a way to connect, even after verbal communication has become difficult. When using music therapy, identify music that's familiar and enjoyable to the person. If possible, let the person choose the music. Choose a source of music that isn't interrupted by commercials. which can cause confusion. Use music to create the mood you want. For example, a tranquil piece of music can help create a calm environment, while a faster-paced song from someone's childhood may boost spirit and evoke happy memories. Encourage movement, such as clapping and dancing, to add to the enjoyment. Avoid sensory overload. Make sure you eliminate noises by shutting windows, doors, and by turning off the television. Make sure the volume is not too loud.
One type of mental disorder that can be treated with music therapy is bipolar disorder. Bipolar disorder is characterized by extreme fluctuations in mood. These moods are classified as manic and depressive episodes. Manic episodes are defined by an abundance of energy, high levels of excitement, and often uninhibited decisions. People experiencing manic episodes often spend large amounts of money without thinking of the consequences, or set unrealistic goals for themselves because they feel like they can do anything. Depressive episodes are the exact opposite, as they are defined by low energy, a lack of motivation, and extreme sadness. People going through depressive episodes will often isolate themselves by cutting off social connections and avoiding their friends and family. It is not uncommon for people with a depressive episode to feel very upset over decisions they may have made during a manic episode. Bipolar disorder can be very disruptive to people's lives, so treatment generally hinges on managing symptoms of the mood swings and trying to reduce the severity of the manic and depressive episodes. This is where music therapy comes in. Integrating music into more traditional therapies can help reduce stress caused by this disorder, as well as making it easier for the patient to talk with a therapist and deal with their emotions. When picking out music for a therapy session, it is important that the therapist choose the right songs. The song should be something that the patient will like and find helpful, but it is also important that the lyrics of the song send the right message and do not make the patient feel worse about themselves. Another important factor in choosing songs is what type of episode the patient is currently dealing with. By using music with a tone opposite that of the episode the patient is currently experiencing, therapy can help bring the patient's mood back to a more stable medium. Upbeat and happy songs can be used to improve the patient's mood during depressive episodes, and simple and calming songs can help the patient relax during manic episodes. Though music alone may not be enough to solve all the challenges people with bipolar disorder have to deal with, when used along with other methods of treatment, it can help reduce symptoms and improve their day-to-day lives.